Good morning, everyone, esteemed panelists, and my dear colleagues. I'm here to present a rare case report of unveiling the unforeseen. So, a 29-year-old female patient from Eastern India had undergone uneventful femtosecond-assisted LASIK for myopic astigmatism for a refractive error of minus 2.5 spherical and minus 1.5 cylindrical at 90 degrees in the right eye, and minus 2.25 spherical and minus 1 cylindrical at 90 degrees in the left eye with BCVA 6/6 in both eyes. So she presented after 1 month with blurring, irritation, and mild redness photophobia in the right eye. There was no recurrent corneal erosions or fingernail trauma in the past. Her family history was non-significant, and her drug history, she was on hormonal therapy for polycystic ovary disease 1 year back, and she had stopped the treatment since last 1 year. Her socioeconomic history was not significant. Her general examination and systemic examination were not significant. On ocular examination on the day of presentation, she had a visual acuity of 6/12 in the right eye with a diffuse haze at 7 o'clock position at the margin of the LASIK flap with overlying epithelial cysts suggestive of stage 2 diffuse lamellar keratitis. So here in the picture what you can see is the black arrow shows the epithelial cysts and the white arrows shows the diffuse lamellar keratitis at the flap margin. So this was the antersegment OCT done on the day of presentation. So the white arrow shows the epithelial cyst and the blue arrow shows the diffuse lamellar keratitis at the flap margin. So we started her on topical hourly steroids, prednisolone acetate 1%, but we had a surprise awaiting. So on the day 2, she had a clinical picture like this with worsening of symptoms and an epithelial defect with in the pupillary axis with diffuse lamellar keratitis. So what we did was we stopped the topical steroids immediately, and we did patching with bandage contact lens for 48 hours with antibiotics. She was symptomatically better after 2 days of patching, and even the epithelium started healing. So after the healing of epithelium, we started her on tapering dose of topical steroids, and the diffuse lamellar keratitis healed completely with minor residual refractive error. The enhancement was not done. So this is the final picture of where we can see the epithelial has healed completely. Her final BCVA was 6/6 in the right eye with residual refractive error of plus 0.75 cylindrical at 165 degrees after 1 month. So the patient did not want a re-enhancement. So we present a case of EBMT, epithelial basement membrane dystrophy, diagnosed 1 month after the femtolasic surgery. So similar case was first reported by Garcia and Gonzalez after 4 days of femtolasic, which is the presenting sign of a silent EBMD. So the shearing force of the microkeratome blade results in a epithelial defect after the microkeratome LASIK, whereas in our case and also the previously reported cases, the surgical trauma from the docking procedure with the femtolesa might have been very less. So it causes a significant delayed subclinical EBMD. So to conclude, identifying epithelial basement membrane dystrophy preoperatively is very important for refractive surgeons to prevent such kind of complications, and also in cases where it is detected perioperative or postoperative period, these patients must be followed up and treated meticulously to prevent vision loss. So here are a few of the references. I would like to acknowledge my mentor and my colleagues. Thank you.
History of the same disease was there?
No.
Nothing. Did you stain the case and see?
Yes, we stained it. Actually, I did have a picture, but the picture quality was not so good. That's why.
So what was there after stain? What could you see?
Yes, it stained with fluorescein. But initially, when the DLK was there, it stained positive.
Okay, so that is a very important slide that you missed.
What about the other eye? EBMD usually is bilateral. So
Yes, but the other eye did not have any symptoms.
another thing, the case presented the very next day.
No, after 1 month.
Presented after 1 month.
Yes,
So how do you conclude that it was because of the femtolasic?
Because, ma'am,
1 month, anything could have
yes,
happened.
ma'am, because it happened at the flap edge. It started from the flap edge and then gradually it proceeded towards the visual axis. So might have been some, there might be an underlying inflammation which was ongoing.
There can be epithelial ingrowth also. It presents similarly.
Similarly.
But there was no sign of any epithelial ingrowth.
Because usually if it's basement membrane, it should have happened just at the moment when the trauma took place. if the basement membrane
Yeah,
is loose?
intraoperatively, ma'am, it was totally uneventful. Like there was no epithelial abrasion or anything.
Okay. Very good slides. Good
Thank you.
presentation.
Thank you, ma'am.